milligram, okay, intramuscular, subcutaneous, all the other choices that you would be injecting into the patient. There's also that you might be putting the patient into the patient's IV, which would be IV push, okay? So we're gonna talk about syringes. Now, if I turn out the lights, are you gonna go to sleep? No. No guarantee, that sounds like, all right, I'll try to be entertaining, extra entertaining. All right, so we have your syringes. So, there are different types of a syringe. Now, again, not nursing 17 material, so don't say, oh, there's a barrel to plunge in the tip, okay? I'm not gonna ask you that, all right? This is all about numbers, all right? So here's your tip where the syringe, where your needle gets connected to. This is your barrel, and this is your plunger. As you can imagine, they come in all different sizes because the amount of medication you need comes in all different amounts. So, for example, if I did my math, and we did our math today, and we came up that we would need this patient's going to need 3 mLs of medication. Am I going to go ahead and grab a 100 ml syringe? No. Of course not. Right, exactly. I would be grabbing like a 5, right? Yeah. So if I needed 1 ml, I'd grab a 3. Yeah. So just where you have, you choose the right size syringe that you need. They come in all different circumferences, alrighty. You might hear somebody call it a cc. Cc is the same as an ml. So if I say to you, give 10 cc's this meds, like us old people, we're still married to the cc stuff. If I say 10 cc's of this med this patient's going to get, how many mLs are they going to get?
10 ml.
10 ml, correct. Okay, here's commonly used syringes. We have all different kinds of syringes. We have also tuberculin syringes where they put you do your PPD testing. Does everybody have PPD testing, or you guys just all did quantiferon?
I had the testing.
Yeah. So have you ever had PPD testing? Yeah. So they put a little, it's an intradermal needle, goes right under your skin. They inject the solution, and then it would see if you would positive or not. We went away from that. You know why? Anybody ever have the BCG vaccine? Right? So every time you have the BCG vaccine, that means every single time you're going to be PPD positive, which means then you got to get a chest X-ray, right? So that's why it was just such a pain in the neck for you guys. So they came up with the quantiferon, where it's just a blood work, where it doesn't matter if you had the BCG vaccine. And if those of you that were born in this country don't know what that is, we don't use it here in America, but in other countries they use it as a preventive vaccine for tuberculosis. In America, it's not used because it wasn't found, evidence-based practice showed that it wasn't that really effective. That's why.
But from blood also, we can know, right?
Yes, blood, yes, which is better, the quantiferon. Okay, so there's also insulin syringes, which we're going to be talking about a lot today, insulin syringes, and prepackaged cartridges, meaning that in your...
comes ready.
It's already pre-filled, exactly. So if say right now we have these things called Pyxis, which is where your either your supplies are in your supply room, and there's also one behind the nurse's station where they have locked up controlled medications, high alert medications, and you would go into your Pyxis, you would put your code in or your fingerprint or both, and let's say your patient had an order for 2 milligrams of morphine, you would go get a pre-filled syringe of morphine, which is fantastic. We didn't have that back in when I rode my horse and buggy to work, right? We had to like pull up from the multi-dose vial, but you guys have it. I want to say easy. You don't have it easy, but you have it different than I did. Okay, so these are different. All right, let's talk about administering and mixing insulin. Students, every time I teach this go, but it's going to be okay, I promise. All right. So, do you all know what insulin is?
Yes.
What type of patient is it used for?
Diabetes.
Diabetics for the most part, right? Insulin is a hormone that we all have in our body. Well, hopefully we all have in our bodies. If you have type 1, you don't have it. But we have in our body that will bring down the glucose level. So our body's designed that when we eat, our glucose level goes up, our pancreas releases insulin, brings it down. We have a nice controlled balance of glucose and insulin in our body. some of your patients don't have that ability. Next semester, when you see me in 21, we're gonna be talking all about diabetes and all about the problems that happen with diabetes. But for right now, a quick synopsis of it is, sometimes your patients, anybody give insulin yet? No? Okay. When your patients that are diabetic in the hospital, when they're about to eat, say breakfast, what do you think is gonna happen to their glucose level? It's gonna go up, right? So what we know from years of studying diabetes is that every time your insulin goes up and your glucose level goes up and down, up and down, up and down. When it goes like that, that roller coaster ride type of thing, the patient has much higher risk of body damage to the body organs, like the heart, the brain, the blood supply, all that kind of stuff, kidneys, the eyes, right? Diabetes, number one cause of blindness. We know now that if we prevent that up and down, up and down, up and down, just go shh, the patient has less chance of that happening to their body. So when we know evidence-based practice, we know that somebody's going to eat breakfast, their sugar's going to go up. So how are we going to counteract? Give an insulin, right?
But before breakfast.
Before breakfast.
Yeah. So what we're going to do, what you do in the hospital is you check your patient who has diabetes, their finger stick 3 times a day, and then at bedtime. So before each meal and at bedtime. And depending on how much sugar that patient's glucose level that patient has, you're going to administer insulin. Oh, did I lose my picture? So you're going to know that you're going to deliver insulin possibly to that patient to counteract that high peak of glucose. So say you came in 7 o'clock in the morning, your shift starts. Your nurse's aide took the patient's blood sugar, because they can do that, right? They can take a blood glucose reading, but they can't analyze it. You have to analyze it. Then they say, okay, your patient's blood glucose level is 184. You do not have to memorize this for 17, 18, 21, or any nursing course you're going to have. You do not memorize this, right? If this would be a test question, you would get this scale, the insulin scale. In the hospital, it's right on your electronic health record, the insulin scale. It's called the insulin sliding scale. So my patient's blood sugar before breakfast was 184. I say, okay, 184 falls between this, right? So I know that I'm going to give this patient 3 units of insulin. Okay? What if my patient's finger stick was 89? Nothing, right? Yeah. It's good range. I'm not going to give any more. What if it was 274? 8 units, right? Regular insulin works very quickly. So it's going to counteract the extra insulin, extra food that the patient's going to get to rise the sugar. Okay? With me?
Yes.
All right, so that's regular insulin.
Professor,
Yeah.
why is it given before, not after a meal?
That's a good question. So it's given before because it takes about 30 minutes to start working, right? So textbook is going to tell you to give it about 30 minutes before they're going to.
Right, because
Belomo's going to tell you in real life, right? So textbook says about 30 minutes prior. So if you know the breakfast is good, the patient's going to eat at 8, you're going to give it at 7:30. Let me tell you what's going to happen in real life. You know that every single day, the dietary comes up with a truck full of your patient's trays at 8 o'clock. So you're going to say, okay, I'm going to give my patient the insulin at 7:30 because that's what I learned in school. Guess what's not going to happen that day?
they may come late, maybe.
Yeah, something's going to go wrong. So the food truck, I don't know, there was a fire in dietary. The conveyor belt broke. The truck came up, but your patient's tray's not on there. Alrighty, these are real life situations. So now you have a patient where you gave insulin to, but you have no food to balance each
Or
other
they don't
out.
want to eat yet.
So what's gonna, or they maybe, yeah, what's gonna happen to their glucose level? Because you gave the insulin, it's gonna
go down.
and now they're hypoglycemic, right? So I'm telling you, make sure your patient's tray is on there. Make sure you see it. Make sure your patient's tray is on there. then go ahead and give the insulin. If your patient's refusing to eat, you gotta find out why. Why? Are they nauseous? We have to give them an antiemetic, right? Do they just not like the food? I mean, I've never heard anybody say they don't like hospital food. I mean, it's like 4-star stuff, right? You know, like Gordon Ramsay cooks that stuff, so I don't know why anybody wouldn't like it. What do you do? What do you do if your patient really doesn't eat it? I went through this with my mother-in-law recently in the hospital. She's a diabetic. She's an old-fashioned Italian woman. She is not eating that hospital food. They sent us spaghetti and meatballs one day. Oh God, that didn't go over well. What do?
You have to bring them food.
from home.
Well, yeah, maybe from home. Also talk to dietary. Let's find out her likes and her dislikes. So maybe we can get, she doesn't have a lot of likes, but maybe we could find something that she would eat. Or maybe we could eat more food from home for that, okay? So that's what you do. All right, so that's your regular insulin. Regular insulin works fast. It goes in, it goes out. We're good. We're just covering for our patient's possible potential rise in glucose. Now, there's other insulins called NPH, which is a intermediate acting insulin, which takes longer to rise. I said regular is about 30 minutes. You do not have to memorize this for nursing 17, but regular is about 30 minutes in order for onset. Your intermediate is about 2 to 4 hours for onset. So it takes longer for onset, lasts a lot longer, and then goes away about 12 hours. So these are things you got to know when you're giving your patient insulin. Then we also have something called long-acting insulin, which lasts for 24 hours straight. The patient only has to get it once a day because it lasts 24 hours. So there's short-acting, there's intermittent, there's long-acting. Your long-acting can never, ever be mixed with anything else. It can only be given by itself. It can't be mixed with anything else. That's your long-acting. Your short-acting and your intermediate-acting can be mixed together if the doctor so orders. Okay? So, let's go back to our PowerPoint. How are you going to mix it? Well, let's say the doctor orders for the patient to have, I don't know, let's make up some numbers. 8 units of regular insulin plus 12 units of NPH. NPH is called either NPH they might write Humulin N. If you see N, you know it's intermediate, okay? If you see R, you know it's regular. So it says Humulin R, you know it's regular. If it says Humulin N, you know it's intermediate. Or you might just see it written out regular insulin, or you might just see it written out NPH, okay? With me so far? All right, so how many total units is this patient getting of insulin? 20, right? 8 plus 12, patient's getting 20 units of insulin. There is a very specific way that you have to withdraw this so you do not contaminate the insulin. All right, you're withdrawing this from vials. There's not a pre-filled syringe. You're withdrawing this from vials. So, first step is you're going to withdraw 20 units of air into your vial. This is an insulin syringe. What I'm doing here. Let's pretend this has a cap on it, and this is capping the needle, alrighty? So, here's my insulin syringe. What I would do is I would withdraw 20 units of air, right? Because it's a total, 8 units and 12 units, that's where I get the 20. Now, I'm going to take, let's say this is my NPH insulin, this is my Humulin N. I'm going to cleanse it off with alcohol wipe, because it's a multi-dose vial, and I am going to inject 12 units of air into the NPH. That has to go first, so the air goes first into the NPH. So I'm doing 12 units of air into the NPH. Withdrawing the needle. Now grabbing my regular insulin. I'm going to inject 8 units of air into my regular vial. Turn it around. I'm going to withdraw 8 units of insulin. Okay? Pull it out of my regular. Grab my NPH and just put the needle in. withdraw, how many units?
12.
12 units. So I have a total of 20 units. Then I'm gonna cleanse my patient's skin with alcohol, and I'm going to inject the 20 units of insulin. Yes,
What was the air for? Why?
because, good question, these vials, these multi-dose vials are vacuum packed. I have to inject air in order for them to let me take the medication out of it. Otherwise, you won't be able to get the medicine out,
Oh, okay.
okay?
The air was 12 or 20?
Well, first you withdraw 20 in your syringe, right? Now you put the amount of air in each syringe that the dosage is.
That's unique.
So I needed 12 of MPH. And I very specifically did that first, because when you're putting air in, it's first the MPH. Now again, this is not gonna be a nursing 17 question, but this can be a nursing 18 question. So I'm putting the 12 units in the MPH, right? Then I'm taking it out of the MPH, I'm grabbing my regular. I'm putting the 8 units in the regular. Turning this around, withdrawing the 8 units of my regular. Taking it out, taking my MPH back, putting the needle in, pulling my 12 units, so I'm up to 20 units, take it out, inject my patient. Okay, so I'm gonna show you the picture here. So it's very specific, the way you have to do it. So you inject the air into the MPH first, right? The amount of air you need. First you pull out the total amount. So let's say the doctor wrote for you to have, let's do 10 units of regular. And, oh, I made a mistake. All right, let's just go there. 10 units and let's say 15 units. Where did I make a mistake here?
Now? 25 units.
It's 25 total, right, yeah, no, I'm sorry. But where did I make a mistake here and here?
It's MPH first.
No, where did I make a mistake? I made if this could be a possible medication error.
Maybe 15 in regular.
It's not about the number.
The
you. This has to be spelled out.
units.
Let me tell you a story that happened in the hospital. For my last role in working in the hospital was nurse educator. So every time, new material that comes, I teach, blah, blah, blah. And also, if something went wrong, we do a corrective action plan to try to make sure it doesn't happen again, right? Brand new nursing, brand new. She was like you yesterday. Now she's got a patient load. She's an RN. She picks up an order for this, of regular insulin. This was back when we used to write it out.
What is that?
Yeah,
10 or 100?
Bingo. She read it as 100.
Oh my God, it's 10 years.
It's 10 units. She gave the patient 10 times the amount of
Oh my
insulin that the
goodness.
patient
What
would have.
happened?
Patient survived?
Thank God, yes. The patient survived. Went to ICU for 5 days, but survived. So that's an entire insulin syringe filled of insulin. If you ever have to fill an entire syringe, you need to check this again. You need to check this with somebody else.
That's
Some
a lot.
hospitals that you might work in, like say for example Coney Island Hospital, you can't give insulin until you've checked your dosage with another nurse. So in other words, and I just want to show you, and I'm going to pass this around, and I want you to see, now this was an entire syringe filled, right? I'm going to show you, it's like we say let's say our patient needed 3 units of insulin. I'm going to show you what 3 units looks like.
Oh
Please
my
don't
God.
change it around, all right? Just leave it just like this to see how potent and how strong insulin is. That would be the amount of insulin the patient needs. It's like this much.
And it's strong.
It's very, very potent. It's very strong. So please be very, very careful. So that's why I made that mistake. Okay, so let's say your patient needs a total of 25 units of insulin. So in your syringe, you're withdrawing 25 units of air. Pulling back 25 units. Then you're going to inject 15 units of air into the MPH. Then 10 units of air into the regular. Then you're going to withdraw 10 units of regular and 15 units of MPH. Okay, so see this picture here? Inject the air into the MPH. Remove your needle, inject your air into the regular. Just flip it around. The needle's already in the regular, withdraw the regular, and then draw your NPH. Yes?
So why do you mix the regular with the MPH?
You don't mix, inside a syringe, you mean, why is that order for? Because the patient may need two different things. They may need the, blood sugar to come down quickly, but also to stay down. Your regular insulin works really fast, it works within 30 minutes, but it's gone in like 2 hours, right?
Regular?
So, regular, yeah. So your NPH takes like 2 to 4 hours to work, but it stays in the body longer. So the doctor's just trying to balance out your glucose. Bring it down a little bit, but keep it down.
So you can't give them like, this one separate from the other one?
Well, then you have to give them 2 injections, right? You have to stick the patient twice. You can, but you have to stick the patient twice. They're not gonna like you that much. Because you can mix this together. Regular and NPH can be mixed together and given in one syringe to the patient. If the doctor has a long-acting, like insulin glargine is one example of a long-acting insulin, it cannot be mixed with anything. It has to be by itself.
Okay, so, sorry. Can it be mixed with another medication?
No,
Or just
no,
insulin?
Just insulin, just together.
And
the
the
insulin.
NPH also always comes first?
So always first for the air injected.
Mm-hmm.
So when you inject the air, it's NPH first. But when you're withdrawing it, it's the regular first.
Okay.
Now you're gonna hear nurses all the time, because it's the way we all learned it in school, clear before cloudy, right? Clear before cloudy. Regular insulin is clear. NPH is cloudy. So clear, you withdraw the clear before you draw the cloudy.
So what happens if it goes other way around?
Yeah, well technically it's, with the air, it's cloudy before clear and then clear before cloudy.
No, I mean, what happens if you withdraw?
You can
Okay.
contaminate so what you're doing is you could accidentally contaminate the regular insulin with the NPH, and then it's not gonna work as fast for your patient, and your patient could become hyperglycemic. That's the whole reason for this, is not to contaminate the regular insulin. Okay? All right. Questions so far? All right, let's do a couple of practice questions. Now these aren't too hard, so don't call out the answers if you don't mind. Just let's wipe out some of those cobwebs from the last week. All right, doctor orders 4 milligrams of morphine. This is the abbreviation of morphine. If you see this, MSO4. Q4 hours, IM, for pain. On hand, we have a vial of morphine that contains 2 milligrams per ml. How many mLs per dose? And again, this is very easy to call out the answer because it's a pretty easy one, but I just want you to get used to dimensional analysis.
2 mg is, and then 1 ml?
Per 1 ml, yeah, this is a per. How many mLs per dose? I know, but I need you to do it in dimensional analysis, because I just want you to just get used to that. Not hard, right? All right, so what'd you come up with?
2 ml.
Right, so it's 4 milligrams, the doctor's order. Each ml contains 2 milligrams. Get rid of that, get rid of that. 4 divided by 2 is 2. What if I said per day?
Divide
By 6, right? Q4 is 6 times a day. So that would be 12 mLs, would be your answer. With me?
Yes.
Okay. Alrighty, let's see what we got here. Doctor orders 40 milligrams of furosemide. What is that?
It's diuretic.
Diuretic, right. What kind of diuretic? It's a loop diuretic. Did you learn about it yet? It's a loop diuretic. What what do you call it? Electrolyte do you lose potentially when you're some potassium, right? So you have to monitor the potassium. All right, 4 milligrams. On hand is 10 milligrams per ml. Again, I know that you could call this out, but don't. Tell me how many mLs you're going to give this patient. After you inject these, your syringe, where does it go? Shot container, right? Even if you didn't use it, like let's say you were using it and it dropped on the floor, you still take it and put it in a shot container. Because if God forbid this washed up, I don't know, in like Rockaway Beach, how would I know if it was clean or not, right? So always in the shops. All right, so 40 milligrams the doctor ordered. We know that each ml is 10 milligrams. Did we all come up with this?
4.
All right. What's the answer?
4.
Okay. How do we say in Staten Island? 4. All right. I'm not going to teach you math. I'm going to teach you Staten Island too. All right. So Staten Island, the answer is 4. All righty. You with me?
Yes.
All righty. Next thing we're going to look at is some medication. So sometimes, we saw this, right? Your medication is in liquid. So all I have to do is do the math, right? We came up with that 4 mLs. I would just have to take my syringe, pull out 4 mLs, give it to the patient how I was supposed to give it. That one maybe IM, I'll give it IM. Sometimes the medication is not stable in liquid form. Meaning, why might that mean? It's not stable to sit on a shelf for 6 months, a year, until we give this to the patient, like in your pharmacy or something like that. So what it does is might have to come in powder form. So this might have powder in it. I have to what's called reconstitute it. I can't withdraw powder. I think we should all know that, right? I can't take my syringe and pull up powder and inject it into my patient, right? I have to turn this into liquid. So how do you turn powder into liquid?
Mix it
Mix it with liquid, right? So sometimes you're going to have to add liquid in order for it to be in liquid form, and then that will be the correct dosage. There's a certain amount of liquid that you'd have to add in order for the concentration to be that amount that we want it to be, okay? Alrighty, so this one we just did already. Okay, so when we have to add the liquid to a powder, it's called reconstitution. So let's take a look. Let me turn off the lights for a second. Let's take a look at that. So there are things here that you need and things that you don't need in this number. Now this, you do not need in your number how much fluid you use to reconstitute it. It doesn't matter. All you need to know is how much to put in it and then how much to withdraw from it. So, client is to receive 900 milligrams of clindamycin. What's clindamycin? Antibiotic. Very good. The label reads, add 4.8 mLs of sterile water to the vial. That means it's a powder. And now I have to take 4.8 mLs and put of fluid, normal saline, and put it into this powder. Shake it up. Once I do that, once I put the 4.8 mLs of sterile water in there, then this becomes, each ml becomes 0.4 grams. Okay, this is what the manufacturer told me to do. So how many milliliters equal the prescribed dose? Well, the doctor says 900, right? We know that each ml is 0.4. So you have 900 milligrams, 0.4 grams. So you have 900 milligrams. Each ml is 0.4 grams. Can we cancel out milligrams and grams? No, we cannot, right? So 1 gram is 1,000 milligrams. So it comes out to 2.25 mLs. Now, I can't give 2.25 mLs. I have to round to the nearest tenth. So how many mLs am I giving this patient?
2.3.
2.3, exactly. Why do I know that? Is because this 5 and greater goes up, right? So that's why it's 2.3 mLs I would be giving this patient. Now, I am sure when we do these practice questions, there's going to be quite a few of you that are going to try to do something with this number. So when it says add or reconstitute with, you cross that out. You don't need this. You don't need that number. That is just how much liquid I put in to make a dose. It doesn't matter.
So you don't need to add the 4.8, you're
And
only
if no-
dealing with the vial of what it says it comes out to?
Correct,
Okay.
correct. You don't need the amount of fluid that you added. Not part of the equation that you need. It's not going to affect how many mLs you're giving this patient. It's only added to make the concentration to be what it needs to be. It's not, and it does not affect what you need to give your patient. Let's do a practice one. All right, the doctor orders 750 milligrams, Q 8 hours. On hand, you have a vial that reads, for 1 gram, add 2.5 mLs of sterile water. Every time I write sterile water, I'm just going to do SW, okay? Because this way I don't have to spend so much time writing out sterile water. And shake to provide an approximate volume of 3 mLs. How many mLs are you going to administer? And round to the nearest 10. So let's do this one together. Alrighty. So I know I need mLs. Okay? Going back to the doctor's order. What is the doctor's order?
750.
750 milligrams, right? What don't I need here?
Yeah.
Yep. As soon as it says add or reconstitute with, that amount you don't need. Because that's just how much you're putting in this vial to make it liquid. Has nothing to do with how much you need the patient. Okay? So now I know that in order to get 1 gram of this medication, 1 gram is 3 mLs, right? So I'm going to put my 3 mLs here, my 1 gram here. All right, I have my mLs. Do I have a problem here though?
Right. Yeah, what's milligram, gram?
And grams, correct. So how am I going to get rid of that?
1 gram,
is 1,000 milligrams. Get rid of that, get rid of that. 750 times 3, which comes out to 2250, divided by 1,000. That comes out to, if you do the math, 2.25, just like the other one did. So what is my answer if I say round to nearest 10? 2.3. 2.3, right. You're going to give this patient 2.3 mLs. You with me? Mm-hmm. Well, let's see, because I'm going to make you do one now. Alrighty. Doctor orders to give 75 milligrams IM stat. On hand, you have a vial that reads for 100 milligrams, reconstitute with 2 mLs of sterile water. You know that the C with the line above it is with, right? That's abbreviation for with. For a volume.
It plus without, right?
What, baby?
It
With S with a line is without, yes. For a volume of 2 mLs. How many mLs are you going to give this patient? What does stat mean? Right away, exactly.
For 9 volume.
For 100 milligrams, that's a G, 100
The
milligrams
last line.
for a volume, that's not a 9, sorry, for a volume of 2 mLs.
Yeah.
So now, so for 100 milligrams, you can reconstitute 2 mLs, you know, you can do that, for a volume of 2 mLs, so we have here when we go here.
I think it was.
Excellent.
Learning fast.
Fast, very good. Very good.
Excellent.
You guys look good. Wow, you guys are on fire today. You brought your brain cells today.
Some of them.
Ignore that one, yeah. Whenever they
From the ATI, you know, after what the thing, yeah, I was sleeping. It was so boring. So boring. And she doesn't explain anything. She's just like,
Waste of time.
what's the
We missed
point?
lecture.
Exactly. What's the point? When we say a lecture and then it is coming soon.
Yeah.
You're just gonna throw everything at us?
Did you start oxygen? Did you start? No?
We didn't start. We made the same class.
Yeah, no, I started it by myself.
Oh yeah, I'm not reading textbook. That I'm not gonna do.
It didn't help me last time.
I'm not gonna do that. I'm just waiting for her to explain, then I will do the prep you. I just rested the 4 days because my head was boiling.
Nope, you don't need that because it's already, this is in milligrams and that's in milligrams. Yep, 1.5 is your answer, yep.
Excuse me.
Oh, I was like, what are you doing? You want to come back again?
Yes.
Couldn't get enough?
Thank you.
All right, so back to the doctor's order is 75 milligrams, right? So we know I don't need this, correct? So I know that the volume of 2 mLs is 100 milligrams. Get rid of this, get rid of this. 75 times 2 is 150 divided by 100. I'm giving this patient 1.5 mLs. Try to pick this up fast. Nice job. Alrighty, on hand, you have a package that reads add 3.2 mLs of sterile water.
Isn't that on hand?
No, just leave, I'm gonna erase that, just give me a second. To yield 375 milligrams per ml. How many mLs?
3.75?
Hold on a second. Oh, I do need an order, sorry. Doctor's order, whoops.
It's 3.75 or 3.
Oh,
that's on
3.75.
1.5 grams is your doctor's order, right? On hand, and 3.2 mLs of sterile water to yields 375 mLs, 300 milligrams per ml. How many mLs are you gonna give this patient?
Didn't have the calculator.
Oh, yeah. أتمنى لو يصير
All of us, trust me.
أتمنى لو في مدرسة الأيتين هذه
أيوة.
يا ريت نغير عندها.
When I January 1st, that's what was my due date for my first daughter. And then the stupid doctor caught me on the 27th of December. You see, I told you I was not even due. He said this is, I was not even due yet. Be careful, don't, of course, and you know what he said? No, we don't. Of course they get extra, that's no problem. Like you having a surgery. It's not, you're not pushing the baby, you know, so extra stuff, extra time. Don't let them trick you. Do your research from now. If I go back in time, I will go to a midwife. Never go to a doctor.
I did it
Somebody give me
twice.
this advice. Because she's not allowed to cut you.
Yeah.
So she's gonna try
Try to do it, yeah.
natural. She only send you insurance pay, yes, it's cheaper than even doctor.
You know, the two first deliveries I did by myself with midwife, and it was so easy.
Yeah.
And the third, they cut me.
You see? So always midwife. I didn't know.
In Queens, yeah.
All right.
His name is Nanda.
Yes.
Telephone?
Yeah.
Okay, so, no, 300, there's,
You think he would come?
there's 1 ml and 3.75.
From the way you talk to your doctor, it seems like
Let me do it, I'm gonna do it on the board, watch this. So,
one of them.
what don't I need here? 3.2, right? It says add or reconstitute, I don't need it, all right. So, start with the end. If you're not, trust me, if you're not really sure so far, I promise you it's gonna be easier for you to start with the end because you say, okay, everything else has to go, right? So then I go back to the doctor's order, 1.5 grams. All right, what else do I have here? Do I have anything that says mLs in there?
Yeah, ml.
1 ml.
375 milligram.
Correct. All right, so I have my mLs, so that's good. Can I cancel these two out?
No.
I cannot. So 1,000 milligrams and 1 gram. Get rid of it all. Just have my mLs. So it's 1.5 times 1,000 divided by 375 comes out to the Staten Island answer of?
4.
Right. 4. Questions on this?
3.
last thing to learn, and then we're going to do lab. So we've done now milligrams, we've done grams, we've done milliliters, we've done milliequivalents, so we're talking about potassium, right? Now we're gonna talk some medications are called in units. All right, that's what it comes in units. Heparin is one of those medications that come in units. Do you know what heparin is? It's a blood thinner, right? It's an anticoagulant, which means it thins the patient's blood. So, this vial of heparin is labeled 20,000 units per ml. The prescriber ordered 9,000 units every 12 hours. How many mLs will the nurse administer per dose? Well, we go back. We know we needed mLs, right? So it's 900 units is the doctor's order. 1 ml in 20,000 units. The answer is 0.45. So if it's, what would we be giving?
It's at 9,900.
Oh, yeah. So let's just say 9,000. Sorry, 9,000, and that comes up with that answer. All right, but we're going to do some practice questions on it. Oh, I thought there was another one. All right, so let's do some practice on the board. A physician orders 5,000 units of heparin. Heparin is available in a 10 ml vial. So a 10 ml vial has a concentration of 20,000 units per 2 mLs. How many milliliters are you going to give this patient? And we'll do this one together. What don't you need here? The 10, right? Doesn't matter that, that's just the size of how much is in the vial. That's not going to affect how much I give the patient, right? So I don't need the 10 here. Okay, so now I go back to my doctor's order. It's 5,000 units. I need my answer in mLs. So what can I put here?
ml
2
to
mLs
ml.
in
2,000.
20,000 units, right? Get rid of my units. 5,000 times 2 is what? 10,000, right. I was going to say, wait, what? 10,000 divided by 20,000. That's where you're coming up with the answer. The answer is what? 0.5 mLs I am going to give this patient of heparin. Everybody good? All right, let's do one more and then we'll do lab. Lab is nice and easy peasy, stress-free. All righty, patient has an order for 10,000 units of heparin, sub-Q. The medication is available as 5,000 units per 2 mLs. How many mLs are you going to give this patient? All right, so let's see, we need mLs. back to the doctor's order, it's 10,000 units, right? What am I putting here?
2 ml.
2 mLs. And what am I putting here?
5,000 units.
5,000 units, right. So I get rid of my units. 10,000 times 2 is 20,000. Divided by 5,000. Staten Island answer is?
4.
Right. Very good. All right. Got it? Yeah. We happy? Yeah. Define happy, Maloma. I get it. All right. So, it's up to you. You guys can, you have a lab now. You can take like a 5-10 minute break, or you can just go right into the lab and get out earlier. Totally up to you. What do you want?
Finish earlier.
Finish earlier. I just always say that. I don't know why.